Jessica. I am 6 days post-op from Advanced Dental Care in Columbia, Illinois. He also has an office in Freeburg, Dr. Cisneros, and his staff has been wonderful. During that appointment last week, he had planned on only removing from the canines back, and that I was pretty well numb all the way through here. He kind of kept going and just removed my entire bottom. And the whole time kept asking me, "Are you okay? Are you feeling any pain?" I felt nothing during the procedure. They numbed with like Q-tips and like a Novocaine on it before they even gave me the Novocaine. And it wasn't really an injection. There was no needle. It was kind of this machine that I guess has a little tiny needle. I don't know. I didn't see the machine itself. We left these 5 because he hadn't planned on doing the front. So I still have to go in and have those done. But I go back tomorrow for my post-op appointment, and I stayed awake through the whole procedure. And he kept saying, "Are you sure you're not feeling that? Are you sure you're comfortable? Are you sure everything's okay?" Um, I'm I was fine. I mean, honestly, the extractions, I had no pain at all. Uh, he, I had a couple of roots from root canals that weren't as cooperative, but I was awake to at least hear about it and know about it. Um, and then I believe in about 2 weeks or so, I will have a temporary wax denture, and then as my gums heal, we'll get a permanent impression, and then we'll, get fit for the implants. It's going to be a procedure, but I'd rather it be done right than be done in a day and have it not work. He explained everything he was doing the whole way through. Let me see what he was doing if I wanted. He was most concerned with my comfort, and that's the one thing I can say over any dentist I've ever been to, was that he really took a lot of care and consideration to my comfort, and you know never did anything without talking to me first. He said, "Are you feeling this?" And if I said I'm feeling that, he would stop, and that's kind of where we stopped here because he hadn't planned on doing the front, but I felt nothing on the bottom, so he kept going. And he said, "Are you okay with that?" "Absolutely. Let's go. Let's do it." And I mean, the first tooth he pulled out, he was like, "Okay, there's one," and I was shocked. I was like, "What do you mean there's one? It's already out?" He said, "Yep, on to the second one." Um, and my roots were very strong. So I had never had a problem with my roots. My teeth were never falling out. They had worn down from the Sjogren's and autoimmune disease that I have. Understanding and compassionate. At one point, I asked him to stop apologizing because every time he did something, he'd say, "I'm sorry, I'm sorry, I'm sorry. I know this hurts." And I said, "No, it doesn't. Stop apologizing. You're doing fine." And his office staff is just phenomenal. I cannot say enough good things about Dr. Cisneros, excuse me, and that was my phone, Advanced Dental Care, and I believe it's advanced-smiles.com. You will not be disappointed if you go see them. They are absolutely wonderful. Every person, from the first person who greets you at the front desk to every person that you encounter that takes you back. Everywhere I read online said I'd have bruising and swelling, and you can see, I really don't. Um, right now my gums still feel a little funky. I have eaten some things. I mean, had some pasta, but I mushed it up first. Baby food consistency, just because I don't want to do anything to jeopardize my healing. Rinsing with warm salt water, doing everything that they told me to do. I keep a bottle of Dasani if I feel I need to swish. Um, but for the most part, I couldn't be happier. I go back tomorrow for my 1 week, and it'll be exactly 7 days post-op visit, and then from there we're going to find out how things are going, and then I believe 2 weeks from then we're going to get impressions for a temporary denture. That's not going to be the end result. It will be implants with, I guess, something they call more like a hyperdenture. It's implants. It'll be a one solid implant with, posts. So that's kind of where I'm at right now. I'm still learning how to talk with no teeth at all, except my two front ones. But and he warned me of that before he did anything. He said there's going to be certain letters that you're going to have to relearn how to say. It's going to be a bit longer of a procedure, which I would rather. He's most concerned with them being successful and not just putting them in and hoping that they work. He wants to make sure that the bone heals properly from the extractions, and if that heals, then more likely the implant will heal properly. But yeah, I don't have any at all. I mean, no swelling, no bone pain, no fractured bones, nothing like that. I mean, I hear all these horror stories you read on the internet, and I have none of those concerns at all. So I honestly cannot say enough good things about Advanced Dental. And again, he's in Columbia and Freeburg, Illinois. He does have two offices. I will keep you posted on my journey. I thank you for hearing me out, and if you have any questions, leave them in the comments. I will be happy to address them. But right now, everything is looking good. I'll know more tomorrow, and I will update you. Have a great day.